So I've already alluded to the fact that Trikafta is a very important step forward for treatment for patients with CF. We have had experience through some of the studies, the research studies that we've been involved with here in CF, and also there has been a compassionate use program where we have had some availability for our sickest patients with CF. So we have some experience ourselves. Also, we've seen some of the experience of our colleagues in the U.S. and Europe who've had access to this. And I don't use the word lightly, but to my mind, this medication can be considered a game changer. There will be variability. Some people will respond better than others. That's inherent with any medication. But we have seen examples of individuals who have been activated on the transplant list, for example, very, very unwell, and with initiation of this medication have been able to come off the transplant list and have been much, much more stable. So it does tend to, the improved function does translate out into to major benefits. We mostly recognize those related to lung function, and that's where a lot of the work has been studied. But there's no question important strides in nutrition, and we're hopeful that many of the other aspects of CF can also be benefited, at least to a degree. Now, does that mean I'm cured from CF? Unfortunately not. It's possible, starting it early enough, that there may be very minimal manifestations of CF over time. We don't know that. That needs to be studied. But really what we're really expecting in the best case is that there will be definitely some improvement, but there still is some pre-existing damage, for example, in the lungs. That is the case. And with age alone, there's some drop-off in lung function. So there still will be some progression over time. But we have had, in the vast majority of our patients, a pretty significant improvement in the clinical course, and hence why we're so excited for this medication. Now, one of the things, I think it's human nature, and we've all done this. If you do get on a medication like this and you feel better, then inherently you'd question, well, what about all these other treatments that I'm spending all this time doing and all this money? Do I really need them anymore? And as I said, even though there's improvement, there's not a cure. Some of the changes that have occurred with CF obviously are still there. So at this point, we are still viewing this as a medication that adds on top of all your platform therapies, and not a substitute. Now, there are studies underway, and we'll have more information about whether it is considered safer to step back on some of the treatments or reduce doses, but we're still early, and my very firm opinion is that it's a very important add-on therapy, but it is add-on, and other aspects of your care are still very important to continue with. There's a lot of other questions, and I would say more around the nuances of this treatment. What are the side effects? Overall, it's been remarkably well tolerated, but there are certain things that we need to watch for, liver function test being one example, sometimes skin rashes, other things as well. But that's the kind of thing that we would need to have more dialogue when we're talking about starting. Who is not going to be a candidate for it? There's not really too many what we call complete contra indications for it. Severe liver disease is one, though, and it would be it'd be unlikely that we would be able to use this medication in those. Fortunately, that's uncommon, but that there are a small number of our patients that do fit into that category. But for mild to moderate liver disease, mild not an issue so much. We still have to follow up. Moderate, that's an individual decision that we'd have to make with you. But apart from that, there's really not too many other contraindications. And tolerances, have we had issues? Yes, we have, but overall, we've been able to work through the majority of these. But that is something that is almost you have to see on an individual basis. So just a bit of an introduction, and we will have an opportunity. We'll be sending out some more written information, and you'll certainly hear a lot more from us in process. And once we get the green light for more broader coverage, particularly the provincial coverage, we'll need to be working as quickly as we can, as efficiently as we can. But again, just to emphasize that you may have to have some patience with us and with the system, because we will move as fast as we can, but we will not be able to get the drug out to everybody immediately. But we're going to take every measure we can to gain quick access. So we look forward to having more conversations regarding this. I'm sure a lot of other questions will arise, and that will follow. But we wanted to get this information out as a bit early, but to be in preparation. And CF is going to look a lot different in the very near future. Very positive, in a very positive way. So thanks, and look forward to having more dialogue.